Chapter 5, we'll be talking about the adaptations to anaerobic training. So in here, just keep in mind essentially the structural, the biochemical, and all the physiological changes that occur from anaerobic training. And we'll define what anaerobic is again in the lecture, but just know anaerobic is anything that really stressing the anaerobic training or energy systems. Those are how we kind of know what it is kind of training we're doing. That is high intensity resistance training, high intensity training, resistance training, speed and agility, plyometric, anything with high power, burst of strength is looking at anaerobic training. So in here, just know the definitions, know more or less what it is that's being changed, the adaptations that occur from anaerobic training, and kind of at the end then too, we'll talk about overtraining and detraining. Overtraining is kind of used too loosely. Usually those who are reached their genetic potential are the ones that can overtrain, elite athletes and so forth, but most individuals can't. And so we use that term a little bit too loosely. A lot of times we refer to as overreaching for most people. And we know that because if you take a few days off, you start to see a performance decrease, some problems occurring, take a few days off, you come back where you once were, that's a sign of overreaching. That's what most people will experience through training. Overtraining, though, is when you see some major decreases in performance and training that even with some rest, you can't get back to that level where you once were. And that's usually only seen, like I said, in elite level type athletes. Okay, so just know, go through this chapter, like we talked about, overall what is occurring when you engage in the anaerobic training. Chapter 5, Adaptations to Anaerobic Training Programs. In this chapter, we'll look at the difference between aerobic training adaptations and the anatomical, physiological, and performance adaptations following anaerobic training. We'll get to the central and peripheral neural adaptations to anaerobic training. How manipulating the acute training variables of a periodized program can alter bone, muscle, and connective tissue. The acute chronic effects of anaerobic training. Look at the acute and chronic effects of training on the endocrine and cardiovascular system. And then the cause, signs, symptoms of anaerobic training with overtraining and detraining, and how the potential to enhance muscular strength, endurance, power, flexibility, and motor performance are all altered. So clearly, key term to know is what is anaerobic training? It's high intensity, intermittent bouts of exercise such as weight training, plyometric drills, speed and agility training, or interval training. And really, anaerobic training is anything that at that point is taxing the anaerobic energy systems. Okay, when you think about it, anytime you're doing any kind of training that hitting the immediate and the glycolytic systems, well, those are the anaerobic energy systems. So therefore, any type of training that's really impacting those systems, that's anaerobic training, such as all these listed right here. It says anaerobic training may elicit adaptations along the neuromuscular chain, beginning in the higher brain centers and continue down to the level of the individual muscle fibers. So central adaptations. It says motor cortex activity increases when the level of force development increases and when new exercises and movements are being learned. One of the first things we start to notice when we start to train is we start to get stronger. But why are we getting stronger? We really haven't added muscle mass within the first few weeks of training. So what is taking place? Well, and we've talked about this, but it's always neuroadaptations are the first. What the body's starting to learn to do is in these higher levels of the brain, then the motor cortex, you start to recruit this understanding, you start to develop this notion needing to recruit more motor units, which then have more fibers, more cross bridges, therefore more force to be able to be produced. Okay, and then from there, the motor cortex starts this learning adaptation starts to then trickle all the way down then into the actual motor units themselves. And there you get the physiological changes. Okay, you get an increase in the whatever contractile properties looking at the firing rate, the recruitment, synchronization of the firing, combination of all those factors. These are the initial parts of training. You get these characteristics there, but then at that point you start to develop, as time goes on, the physiological changes as well to anaerobic training. But the initial ones are always going to take place via the central nervous system and then into the peripheral. So you're looking at neural adaptations overall, the combination of the central and peripheral together. The neural adaptation is always the one that takes place first. You get this better coordination between the brain and the periphery, getting the recruitment of more motor units, the firing, altering up the firing frequency, and so forth. With motor unit activation, this graph right here is detailing out that the smaller, low force producing motor units get recruited first and then continue on to the larger motor units. It's known as Henneman's size principle. It says, according to which motor units contain type 1 type 2 fibers or organized based on some size factor. So the low threshold motor units are recruited first and have lower force capabilities than higher threshold motor units. To get to the higher threshold motor units, the body must first recruit the lower motor unit. And so you basically recruit motor units based upon the threshold. And the larger motor units have a larger threshold, and it's really kind of a way the body doesn't activate all the motor units at one time because they can fatigue out. So you basically start to recruit what is necessary, what is needed to get the task done, and at that point you keep recruiting until you get enough motor unit activation to be able to accomplish whatever task it is you're trying to get through. It says with heavy resistance training, all muscle fibers get larger because motor units are recruited in a sequential order by their size to produce high levels of force. It says in advanced lifters, the central nervous system may adapt by allowing recruitment in non-consecutive order, by recruiting larger ones first to promote greater power or speed in the movement. There's no strong evidence for that second point there, but it's something I tend to agree with, that as we become more trained, the better, the stronger we become, the more developed we become. I would venture to guess that the larger motor units get recruited first because it's an adaptation. The body knows what it needs to get through a task. In a jumbled, confusing way to say it, I guess. But you think of those who are training and they know to get through this right here, the body has a way of knowing exactly what it needs to get through that. So I wouldn't be surprised if it's already recruiting those more advanced motor units, those larger threshold motor units before anything else. And I bet you it's an adaptation that takes time, and that's why you look at these athletes who could perform movements in such a smooth fashion. It's because over the years and years and years and hours of doing a movement, they fine-tune it perfectly. So there's, like I said, no definitive any evidence of this, but it's a common thought that a training adaptation is be able to recruit the larger threshold motor units first. You got neuromuscular junction. So you can get it with this, basically a better workability between the nervous system and the muscle itself. That's what the neuromuscular junction is, that junction point between the two. So some possible adaptations here says increased total area of the neuromuscular junction, get more dispersed, irregular shaped synapses, thus a greater total length of nerve terminal branching. And with all that, you can increase in-plate perimeter length, as well as a greater dispersion of acetylcholine receptors within the in-plate region. So just a more acetylcholine being released over a greater area will then mean a greater muscle activation. And that's how you get that stronger impulse to the muscle. So there's that rate coding coming in. You get this better stimulation of the muscle due to the overall working of the nervous system. So that could be a possible increase in rate coding right there. Anaerobic training may also enhance the reflex response, thereby enhancing the magnitude and rate of force development. So you get a stronger force development and a faster force development. You'll see that in EMG work. I'll come up here in a bit. But nonetheless, when you get a stronger impulse from the nerve and a faster impulse from the nerve, that's going to make a stronger, faster contraction of the muscle, essentially. It is right here. So the increase in magnitude or rate of force development, you see this in EMG recordings. EMG basically tells us the activation of a muscle. And so some adaptations, you'll see an increase in, like I said, the magnitude and the frequency. Therefore, more force production. Studies have shown strength and power increases up to 73%. It says advancement in training contributes to further gains in strength and power. Dramatic increase in neural adaptations take place early in training programs. These are the initial ones that take place once starting off a new training regimen. They've also seen a cross-education. Cross-education is essentially as you train one side, there's going to be an adaptation on the other side, despite not training the other side in a way. But nonetheless, what this is looking at is as you train, as one side gets better, the other side's going to get better as well. There's a bilateral deficit in untrained individuals. And so, and changes in muscle activity of the antagonist during agonist movements. So it's kind of interesting just knowing that the way the nervous system is working is as you train it, the overall system is getting better. And you see like in a lot of those studies where they've looked at just one side, yeah, that one side is going to be stronger if you train just that one side compared to the other. But what they notice is that as you train the nervous system, one side gets stronger, the other one does as well, which means there's some kind of change or some kind of adaptation going on in a global sense, not just in a local sense. Okay, this is good for those who have damage to one side of the body, maybe a stroke patient or something like that. They've had some kind of nerve damage on one side. Well, by training the other side could get stronger as well. Not going to be massive strength increases, but you're going to see some progression. And so that's the fascinating thing about the nervous system is that it tends to work in a hierarchy that controls globally, not just the local areas you're working. So skeletal muscle adapts to anaerobic training primarily through increasing the size, facilitating fiber type transitions, enhancing its biochemical and ultrastructural components, and these changes result in enhanced muscle strength, power, and muscular endurance. So we all kind of know what the changes in the muscle adaptations are going to be. You start training over time, well, muscles get bigger, i.e. muscle hypertrophy. It's an increase in size of a muscle fiber. There's hyperplasia. This is the increase in number of muscle fibers. And we're pretty certain that hyperplasia does take place in the body, but there's no evidence that actually is. The reason being is because we've seen it in animal models, but it's really hard to tell about hyperplasia in humans. So we kind of just go off the notion that, well, muscles get bigger because of hypertrophy, not hyperplasia, despite we're all probably certain that if it's happened in one mammal model, then it should happen in another. How hypertrophy takes place is in the increase in synthesis of the contractile proteins, primarily actin and myosin, within the myofibril. There's also an increase in the number of myofibrils within the muscle fiber. These new myofilaments added to myofiber result in an increase in this diameter. And therefore, more force production just because of the greater number of cross-bridge attachments. Fiber size changes. So you'll see with the resistance training an increase in both type 1 and type 2 muscle fiber areas. And type 2 fibers have a greater increase than type 1. And the fiber type transitions always go in order through resistance training. You'll go 1, 1C, 2C, 2AC, 2A, 2AX, and 2X. We always say type 1, type 2A, and type 2X. But there's always these other continuums between them as well. Those are the three main fiber types: 1, 2A, and 2X. But then you have these other little branches off a little bit as well. But you always go in that order. You never skip over 1. Remember that. You never go from like 1 to 2X. You go in the sequential order right there. It says muscle fiber transitions occur during training. It means that a shift in the type of myosin adenine triphosphate, ATPase, and the heavy chains take place during training. Because when you have fiber type training, transitions, what you're having is you have a change in the expression of the myosin. So there's the heavy chain right there. So we're looking at the myosin heavy chain, so what protein's being expressed, and then the adenosine triphosphatase, so the ATPase, the enzyme that's associated with the myosin heavy chain. Those two things change together because those are what protein's being expressed along with the ATPase, along with it. That's what determines if it's 2X all the way to 1. Remember, though, that with fiber type transitions, you will have some, but don't think that the fiber type changes are going to be drastically enough to make you into one athlete or another. Okay, most individuals are all roughly about the same in fiber type expression. It might be a safe assumption that those who are really good at sprinting might have a little bit more of a type 2X expression in certain muscles than other people, but it's not going to be, if you're Usain Bolt, you're not going to be 95% type 2X, and that's it. It's just some of the muscles might have a little bit more expression, so maybe most humans are probably 50-50 type 1 and type 2, and so it might be one of those things where these world-class elite athlete sprinters might be in certain muscles, maybe, and I'm just guessing, I'm just kind of throwing stuff out there. It might be like 52%, 48%, something like that. But in physiology, those small little differences do make a big change. Okay, and no matter how much you train, if you're not built for strength and power, no matter how much lifting you do, you'll never get to a point to be really strong and powerful based upon genetic makeup. Okay, but we do know that as you resistance train, you do start to adapt some characteristics. Just like when you do aerobic training, you start to adapt some of those characteristics. But you're not going to have a massive fiber type change just from doing one training style to another. This resistance training increases myofibril volume, cytoplasmic density, sarcoplasmic reticulum, T-tubule density, sodium, potassium, ATPase activity. Sprint training enhances calcium release. Resistance training increases the angle pennation. You also will see reduced mitochondrial density, decreased capillary density, increased buffering capacity, changes in muscle substrate content, enzyme activity. So these are all just the biochemical changes that you'll see from resistance training. Next, with resistance training, you get into connective tissue adaptations. One primarily is the changing up of bones. If you want to look at overall bone health, well, do a lot of lifting. I mean, relatively speaking. Lifting is good because it does help out maintain bone health via the amount of stress being placed on the bones. Especially females, as they get older, dealing with osteoporosis. So it's a good idea for them to engage in as much resistance training younger, all the way continue through middle age and so forth, because it'll help out maintain bone health. So how that works, he says application of a longitudinal weight. You can see the force application going straight down. So there's going to be certain bending going on in the bones right there. And the bones can handle quite a bit of compressive force. So as the force is being applied longitudinally, you'll start to get a little bit of bending in the bones, and they can handle quite a bit of force that way. Bones can't handle a lot of, especially long bones, like your femur here, can't handle a lot of shear stress. And so as you train, force is being applied. Think of gravity pushing down, weight pushing down, or whatever the case might be. Causes the bone to bend, says as depicted in the dotted line, creating a stimulus for new bone formation at the regions experiencing the greatest deformation. Osteoblasts lay down additional collagen fibers. It says previous dormant osteoblasts migrate to the area experiencing the strain, and then the collagen fibers become mineralized, and the bone diameter effectively increases. So bones really only are going to adapt and grow if there's a stress placed on them. If there's no stress, then you're going to start to lose bone mass. That's why I urge females to weight train or walk a lot, or exercise where you're having a lot of compressive forces placed on the body, because they'll help out with this bone regeneration. Weight training is just the simplest way to describe that, but even if you walk every day, every time you step, gravity's pushing down, there's a compressive force, so you're going to have some bone remodeling there. So it's a really good idea to engage in these activities to help out with overall bone health. Some general bone physiology says trabecular bone responds more rapidly to the stimuli than cortical bone. Okay, trabecular bone is a spongy bone, or cortical is a compact bone. So cortical is dense and forms basically the outer shell surrounding the trabecular bone. This is minimal essential strain as a threshold stimulus that initiates new bone formation. It's approximately 1/10 of the force required to fracture bone. So you look at anaerobic training and bone growth. It says muscle strength and hypertrophy gains increase the force exerted on the bones, which may result in a corresponding increase in bone mineral density or the quantity of mineral deposited in a given area of bone. So as we train, we lift, we get stronger. Well, as you apply force to the bone, you're applying a bending formation to the bone. And that is then laying down, like we just saw in the last few slides, laying down that new bone formation. So it does help out then with getting that greater bone mineral density. And how can you stimulate bone formation? Well, we've already talked about that. Make sure you overload the musculoskeletal system and keep progressing to keep adapting to a new stimulus. The overload could be lifting. It could be some kind of walking. You just want to make sure you're putting the stress on the body some way, one way or another. And that'll help out with this bone formation. Just make sure you keep stressing the musculoskeletal system some way, somehow. Forces that reach or exceed a threshold stimulus initiate new bone formation in the area experiencing the mechanical strain. So if a bone doesn't experience strain, it's not going to be a new bone formation. So that's why we need a full body regimen training to ensure that all bones to the whole body are constantly getting this new formation. And the strain is always, or I should say the stimulus is always going to be related to the strain. That is, the more intense, the speed, direction, number of repetitions, all these factors are going to, the greater the stimulus, then going to be the greater strain, therefore the greater reformation. You got adaptations, tendons, ligaments, and fascia. It says a primary stimulus for growth of tendons, ligaments, and fascia is the insult from mechanical forces created during exercise. The degree of tissue adaptation is proportional to the intensity of exercise. Consistent aerobic exercise that exceeds the threshold of strain simulates connective tissue changes. Kind of the same thing as the bones. Okay. We always think of just the muscles, and that's it. We got to get stronger. But the connective tissue, the soft tissue is just as important. Because remember, as muscles are developing force, the muscles developing force then pulling into the tendon, because muscles attach to bones via the tendons. So you have then the force going from the muscle into the tendons into the bones. So you need to make sure that your tendons and the ligaments are what holds joints together. So all of these need to be just as strong. Now, granted, muscles always are stronger than these soft tissue, and that's okay, but we need to make sure as we're training the muscles, we're developing those in a way that these soft tissues are getting trained as well. Okay, and the fascia, we haven't talked about a whole lot about that, but fascia is just connective tissue. It's just connecting different. We have a lot of fascia through the body. It's like underneath the foot, a lot of deep fascia there. The ab muscles, a lot of fascia. Abs actually don't attach to a bone. They're all held together via a form of fascia. And so that's another. You always hear the tensor fasciae latae, the muscle on the side of your thigh. Well, there's a lot of fascia down there, and that's why if you ever rolled out with a foam roller, it always hurts right there because you're hitting that connective tissue. It says specific tendinous changes that contribute to size and strength increases. So you get an increase in collagen fibril diameter. Collagen is just a protein within the body that helps out with a lot of structural. It helps out with structure within the muscle fiber and the tendon. So there's a greater number of covalent cross-links within the hypertrophied fiber. An increase in the number of collagen fibrils. An increase in packing density in the collagen fibrils. So the structural protein, collagen, is just going to get increased. The size and strength increases come from, the laying down of that new fiber, laying down of the collagen. So that's one of the things that helps out with the increase in the strength is getting this greater structural protein. And it's just layered throughout the muscle fiber itself, or through the myofibril, I should say. Okay, you can just, this is a structural protein all through all these different tissues. And then, like I said, as we train, and just you lay down more of it, and you get a denser more of it, so it just adds in that strength of the overall tissue. Cartilage adaptations. So the main function is, it says provide a smooth joint articulating surface, adds a shock absorber cushioning between joints, allows for some of that absorption of forces. It says aids in attachment of connective tissue to the skeleton. It says it lacks its own blood supply, must depend on diffusion of oxygen and nutrients from the synovial fluid. It helps out then with mobility. So it says joint mobility is linked with joint health. We always know joints tend to hurt. One they always talk about is, broken down, lacking cartilage. And it does gets worn away throughout time and use. It says movement about a joint creates changes in pressure in the joint capsule that drive nutrients from the synovial fluid towards the articulated cartilage of that joint. And so just for overall joint health, moving through the full range of motion and not overloading will help out with some of these connective tissues working up. But overuse, improper use over time, you start to get the breakdown of cartilage. And not at that point, when this gets broken down fully, you're basically got bone on bone moving across one another. You lose that shock absorbing that connective tissue. says, how can you stimulate connective tissue adaptations? It says exercise of low to moderate intensity does not markedly change the collagen content of connective tissue. It says high intensity loading results in net growth of involved connective tissue. Forces should be exerted through the full range of motion of a joint. And so you need to give yourself enough stimulus to actually have these changes take place. But it's just the greater the stimulus, the more response will come about from here. But it doesn't mean that low intensity exercise is still not good. Okay, those who walk regularly with a balanced diet guaranteed tend to have less issues than anyone else. So it's just one of those things that, you know, the more you put in, the more you're going to get. But then again, there's always that Goldilocks principle. There's a tipping point where too much could lead to too much use and then a negative effect then. From an athlete's perspective, though, make sure you train at high intensity to really get this increase in connective tissue adaptations. The regular public, well, staying healthy and moving will help out with overall functions more than anything else. For cartilage, it says weight-bearing forces and complete movement throughout the range of motion seems to be essential for maintaining tissue viability. And then moderate aerobic exercise seems adequate for increasing cartilage thickness. Strenuous exercise does not appear to cause degenerative joint disease. Okay, there's a difference between losing cartilage and actual degenerative joint disease. Okay, over time, it's going to wear down because everything wears down in the body. But those who actually have a degenerative joint disease and get big time then arthritis and all things like that, that's different than just overuse. Okay, but for the most part, it's if you train properly with enough intensity but not too much, it will help out with all these connective tissues and help keeping them healthy. Hormonal responses. It says the acute anabolic hormonal response to anaerobic exercise is critical for exercise performance subsequent training adaptations. It says the upregulation of anabolic hormone receptors is important for mediating the hormonal effects. So there's a huge endocrine response through training, and the more anaerobic you do and the harder the anaerobic training is, the greater the endocrine response is going to be from there. But over time, the greater adaptations will come about from that. You got the chronic changes in the acute hormonal response. It's because consistent resistance training may improve the acute hormonal response to an anaerobic workout. And then resting hormonal concentrations, consistent chronic changes in resting hormonal concentration are less likely. It says resistance training has been shown to upregulate androgen receptor content within 48 to 72 hours after the workout. So, overall training, especially anaerobic training, the more you do, the more essentially you get an upregulation of some of these hormones and the receptors. And allows you then to keep training at those high intensity. And as you change up your intensity, the body can adapt. Or I should say, as you change up the stress, that is intensity, duration, frequency, all that, then the more trained you are, the more the body can respond to those constant changes, which you should when you're programming up a workout or a training program. You should constantly be making some changes all the time in your program. So as you train, the more upregulation of these hormones, then also the more the body can handle when the new stress is placed on the body. And then you're constantly adapting and growing, adapting and growing. With the cardiovascular response, it says an acute bout of anaerobic exercise significantly increases the cardiovascular response, especially if the individual uses the Valsalva maneuver. Well, if you're holding your breath, you're going to have an increase in blood pressure. Heart rate's going to go up. So those would be some of the responses you get on the acute portion. Chronic adaptations, it says at rest, says anaerobic training leads to a decrease or no change in resting heart rate or blood pressure. Resistance training alters cardiac dimensions. One of the things you'll see with resistance training is an increase in the density of the left ventricle of the heart. And so, which means overall you do get a stronger heart. But, like I said, no change in resting heart rate or blood pressure doesn't mean just because you get a stronger heart, you're going to get a really significantly lower heart rate. A lot of times you see those who do nothing but pure strength training tend to have high blood pressure and a higher heart rate. The good thing would be is if you are doing anaerobic training, yeah, you get the stronger heart due to the increase in left ventricle wall size. But if you're not an anaerobic athlete, I'm just saying just doing anaerobic training, then the lifting will help out with that stronger heart, but make sure you do some aerobic training because they'll give you the cardiovascular changes there. Chronic adaptations of the acute cardiovascular response to anaerobic exercise. It says chronic resistance training reduces the cardiovascular response to acute bout of resistance exercise of a given absolute intensity or workload. So you do get a little bit during exercise, some adaptations to the cardiovascular response from resistance training, anaerobic training. It says ventilatory response, though. Ventilation generally does not limit resistance exercise and is either unaffected or only moderately improved by anaerobic training. But for the most part, you will see during exercise, as you do anaerobic training, you'll start to have a better response, a better ability to handle the workload as we train. Now, at rest, you're not going to see as much changes. Yeah, you do get the cardiac dimension. You get a larger left ventricle. That is, the left ventricle doesn't get better as the wall size of the heart gets thicker. So you do get a stronger heart, but it's only going to be beneficial if you have a change in blood volume and those aspects to get a greater cardiac output. It says acute anaerobic exercise results in the following, an increase in all those. And it makes sense because you're putting more stress on the body. So you need to up all these processes to make sure you can keep performing the movement. Cardiac output go up because, heart rate's going up significantly, and you get stroke volumes going up because there's a lot more demands to perform these anaerobic movements, so you need to have a greater cardiac response as well. Doesn't mean your adaptations, it just means these are going up to match the demands of the exercise. Because the volume's going up, you'll see an increase in systolic blood pressure and blood flow to active muscles as well. So you do get some of these responses. This is just to ensure you keep moving through the movement itself. But if you want lasting chronic adaptations, then aerobic training would be ones you want to be doing instead of the anaerobic exercise. It says combining resistance and aerobic endurance training may interfere with strength and power gains if the aerobic endurance training is high in intensity, volume, and frequency. So if you're an anaerobic athlete, you should do zero aerobic training. Okay, aerobic health or cardiovascular health, all those things, if you're an anaerobic athlete, should not be a concern to you. I know it sounds horrible, but if you're an anaerobic athlete, you should just train anaerobically. Outside of this, though, for health and longevity, we should be doing both. Obviously, I'm not saying aerobic training is bad. I'm just saying that these processes are going to interfere with one another. So as an anaerobic athlete, strength power athlete, you should do zero aerobic endurance training at all, whatsoever. Flip side of that, there's no change in aerobic power output from heavy resistance exercise. There's no negative impact on there. It's only going to be, if you do a lot of aerobic training, it's going to impact your strength and power gains. Strength, says in studies, mean strength increased by approximately 40% untrained, 20% moderately trained, 16% in trained, 10% advanced, and 2% elite. So, nonetheless, all it's really saying is that most of us are not at our strength, our maximum strength level. So by training, we can always stand to get stronger. Once you're become elite status, well, the gains are much smaller because you're getting closer and closer to your genetic potential. It says heavy loads are more effective for fiber recruitment. Well, you want to get stronger, lift heavier. That will recruit more fibers, therefore will get you stronger overall. And the effects of training are related to the type of exercise used, intensity, and volume. Doing the bench press is going to get you stronger than doing the pec deck machine, doing flies on the pec deck machine. Okay, bench pressing at 80% of your max is going to be much better than bench pressing at 40% of your max. And doing one set of 5 is not going to be nearly as good as doing 5 sets of 5. That's all it's saying right there. It says heavy resistance training with slow velocities of movement leads primarily to improvements in maximal strength. This goes back to force velocity. Okay, lifting slow but with super heavy will result in more force output. Therefore, more force is more strength. It says power training increases force output at higher velocities and rate of force development. It says peak power output is maximized during the jump squat with loads corresponding to 30 to 60% of squat 1 RM. Reducing the amount of weight means you'll have less force output, less cross-bridge attachment, but you can move at a faster velocity, a greater velocity, I mean. So it means force times velocity, greater power output. It says for the upper body, peak power output can be maximized during the ballistic bench press throw, using loads corresponding to 46 to 62% of 1 RM bench press. So I'm just showing you is that peak power is always going to come from using lower loads, but being able to move those lower loads at a greater velocity, greater power output. Muscle endurance says cross-sectional data in anaerobic athletes have shown enhanced muscle endurance and subsequent muscle adaptations consistent with improved oxidative and buffering capacity. Skeletal muscle adaptations to anaerobic muscular endurance training, including mitochondria, capillary number, fiber type transitions, buffering capacity, resistance to fatigue, and metabolic enzyme activity. And so when you're looking at type 2A fibers, they become a lot more fatigue resistant because they start to take some of these oxidative capabilities, start to adopt some of those. So a lot of training, especially if you're just doing pure like heavy lifting, not so much, but anything when you add a little bit of endurance in, you'll start to become develop the type 2A fibers, which have these oxidative capacities, which means they're a lot more fatigue resistant. So that's the benefit of type 2A fibers. So resistance training can increase fat mass and reduce body fat by 1 to 9%. And most people always recommend, if you want to lose weight and improve your body composition, running is not the best option. Lifting is always going to be a better option because what happens with the resistance training is you're putting on more muscle. And more muscle, you see in the bottom, a little bit down there, but muscle is more metabolically active than fat. So it takes a lot more to keep muscle preserved and going than fat. So therefore, as you put on the muscle, you will burn off more fat because of the metabolic activity. But then if you look at 5 pounds of muscle versus 5 pounds of fat, the actual surface, the amount of surface it is, you look at fat is 5 pounds is a lot larger than 5 pounds of muscle. Despite being the same amount of weight, the amount of surface ratio that they take up, fat takes up a lot more space than muscle. So always promote, if you want to improve body composition, increase resistance training. That'll help out burn away fat, and also it'll make you look smaller too, because All that muscle takes up less space than the fat. You got flexibility. So anaerobic training potentially can have a positive impact on flexibility, primarily if the individual has poor flexibility to begin with, such as if you start squatting properly, Olympic lifting, all that. Well, you'll start to, those positions take a high degree of mobility, so therefore anaerobic training could put you in those spots to start developing the full range of motion. This is a combination of resistance training and stretching appears to be the most effective method to improve flexibility with increase in muscle mass. Aerobic capacity says heavy resistance training does not significantly affect aerobic capacity unless the individual is initially deconditioned. The exception is in relatively untrained people who can experience increases in VO2 max from 5 to 8% as a result of resistance training. Circuit training and program using high volume and short rest periods have been shown to improve VO2 max. So what they're getting out of here is that you can see an increase in your VO2 max from anaerobic training. It's not going to be to the extent of doing high endurance training, but you got to think you are getting some cardiovascular adaptations via anaerobic training because the heart's still being stressed. And so you'll see improvements in VO2 max from this. Not going to be as much as, like I said, aerobic training, but still you're going to get improvements. If you're looking to just get an improvement in your VO2 max, well, anaerobic will help out with that. You got motor performance. As anaerobic training enhances motor performance, the magnitude of change is based on the specificity of exercises or modalities performed. You can see resistance training has been shown to increase all the following. Basically just stating that you got to think, as we train, we talked about the neural adaptations. Well, you're getting a neural adaptation, from resistance training, but overall, your neural system is getting better in general. So no matter what you do, you're getting a better relationship, better workability between the central and the peripheral nervous systems. So on top of the increase of muscle mass, the strength, and all the things we talked about, you'll get a better motor performance just because you're getting an increase in, like I said, that workability of the higher brain units going to the periphery, between the central and peripheral nervous system. Okay, last few things here. Overtraining. This is defined as excessive frequency, volume, or intensity of training that results in extreme fatigue, illness, or injury. This is often due to lack of sufficient rest, recovery, and perhaps nutrient intake. When you're looking at overtraining, though, I always bring this up, overtraining is really only seen in those who've reached their genetic potential. That is, you're well-trained, you're high-trained, you're elite level athletes. Most people, you see the bottom point right there, it says overreaching. Most people who, if someone's like really tired after training and they take a few days off, they bounce back, they didn't overtrain. They say they've been overtraining, but they haven't. That was just overreaching. Overtraining is where you start to see a long-lasting decrease in performance due to just too much frequency, volume, or intensity. And you can see down here all the different areas where overtraining will be affected in anaerobic performance. You see people, weight loss. They'll see decrease in immune function, sleeping behaviors. This is hormonal concentrations. So all these factors right there, you just will not get the performance out of the athlete that you once had. And you always know if you're starting to get overtrained because if you take some time off and they never bounce back, then you've overtrained. But for the most part, outside those who've reached genetic potential, most people within a little bit of rest, get some good recovery, nutrition, will bounce back pretty quick. But if you see these massive changes, like these weight loss and decrease in any kind of performance factors, sicknesses, decreased immune function, elevated heart rate when it shouldn't be, those kind of factors, and then you try to incorporate recovery and it's nothing changing, then overtraining could be something long lasting and you may never really sometimes recover from it, Or if you do, it just takes a really long time to get back to where we once were. That's why recovery is so important in your programming. Having recovery days, and a lot of coaches will have recovery weeks. Now, you don't want to take time off because you'll see, coming up in the next slide, everyone takes time off because detraining is where you stop training. You never want to get to that point. What our coaches do is they call like a deloading week. And so they basically do the exact same workout through a week, but at a lower intensity, and it allows the body to recover and get back to where it needs to be. So you never want to stop training. You just want to just reduce the intensity or the volume big time to allow the body to recover while still doing some form of training, because it'll help out maintain those increases, those gains that you've gotten. Here's all these other factors. We kind of talked about it, so I don't want to go too much of all this, but you can look over these, read over these. Again, one thing I didn't say is a psychological effect, just the decreased desire to train. I mean, no athlete really loves training so much. It's one of those things you have to do. But also, athletes also like training because they want to be good. So at their sport. So it's not like they hate training. It's a love-hate relationship. Maybe go with that. And so when you overtrain, though, you see them, they just have like, I don't want to say depression type symptoms, but it could be that. And I'm not well versed in what is defined as depression, so I don't want to speak too much on there. But nonetheless, if you see an athlete that just has very low energy, no desire to train, no joy from any of this, that could be a good sign of overtraining there. Okay, so just look through these again, read over these. We talked about a lot of them, so I don't want to rehash it all. But then, like I said, they bring up detraining. So this is defined as the decrement in performance and loss of accumulated physiological adaptations following the cessation of anaerobic training. It can also occur when there's a substantial decrease in training frequency, volume, or intensity. So detraining, not to be confused with what I just said, deloading. Okay, detraining is where you stop training altogether, or you decrease it so much that your body starts to lose any kind of gains that were once built up. A deloading is a loose term that coaches will use to signal that, hey, we're cutting back on intensity this week to kind of help out the recovery. But you never want to detrain, because you'll see 1 week of no training could lead to a 50% loss in metabolic functions. 25% decrease in heart size. And they've seen that just from 1 week of no training at all. So what you want to do is, if you need recovery, if you take a day off from here to there, that's not a problem. You don't want to take significant time off from training. You want to keep training, but cut back on the intensity, the volume, the frequency. You're better off in 1 week to do 2 days spread out by a couple days of decent training than doing 5 days of very low intensity work. That makes sense. So make sure you put in recovery times in your programming. It'll help out keep training at the same intensity. It'll mitigate any kind of overtraining, keep athletes performing without hurting them. Because really the key is, with overtraining, you're putting athletes at a spot where they could become very harmful to their body and very detrimental. And so you never want to get to that point. So it's goal of the strength coach to cut back when they need to, change up the program to ensure that things can kind of recover and get turned back up and get going back at the same intensity that they once were able to train at. To conclude with this chapter, we talked about what anaerobic training is, and then what are the changes occurring. Okay, you start to see structural changes to the ligaments, to the connective tissues, I should say, tendons, ligaments, to the bone. We see all those adaptations occurring. We see the morphological changes of the muscle becoming more type 2, especially type 2A through anaerobic training. We see then the physiological, the biochemical, all those changes that are coming about from engaging in high intensity training, resistance training, agility, speed, plyometric, all those types of training. Those are the changes we begin to see. So make sure you just be familiar with all that. You understand those concepts, and then just exactly what the changes are taking place, and then know like, okay, well, with two greatest stimulus for overtrain, intensity, duration, frequency, we could get to a point of overtraining. Now, granted, I said that's usually through elite level athletes. General, most everyone else who have not researched genetic potential never get to a point of overtraining. Usually that's referred to as overreaching. We know that because, like I said, you take a little bit of time off, you come back to where you once were. That's a sign of overreaching. Overtraining is usually those elite level athletes. You start to see a decrease in performance, more infections, elevated hormones when they shouldn't be, especially during rest, weight loss, psychological impact, lack of desire to train. Those are all signs of overtraining. And like I said, seen in elite level type athletes. Okay, so just be familiar with what we talked about, what anaerobic training is, and then what are the actual changes that come about. All those ones that we discussed, just be familiar with all those and kind of know overall when we're talking about anaerobic training, what it is and what are the changes that come about with that type of training.